Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. Patients are often confused about what is meant by the first trimester of pregnancy. The first trimester is a technical term that is used by gynecologists, obstetricians, and the medical fraternity in general to refer to the first 3 months of a mother's pregnancy. There are certain technicalities associated with this that you should know about, which I'm going to get into in this presentation. So let's go. So the first trimester is basically the beginning stage of your pregnancy. Whenever we count any dates in pregnancy, by and large they are counted from the first day of bleeding of your last menstrual period. So whichever was your last menstrual period, the day on which it started, that's the day from which we begin counting. And the first trimester is usually from week 1 all the way to week 14 of your pregnancy. That's in terms of weeks. It's usually the initial 3 months, roughly the initial 3 months of the pregnancy, and it's called trimester because tri means 3, so it tries to refer to the three months. That's how it's named, and it's just the most earliest part of your pregnancy. So what does this mean exactly in terms of days, months, and weeks? So it lasts for exactly around 98 days or around 14 weeks. It covers the pregnancy from month 1 all the way to the end of month 3. Including from the beginning of the pregnancy, and it's during this time that the baby grows literally from a single cell that is formed by the fusion of the father's sperm and the mother's egg. It grows from that single cell to as big a size of around 3 inches. So what are some important things that you should remember regarding the first trimester? The first thing is that you should always schedule your first prenatal visit by around the 8th week. This is a good time to consult your gynecologist once you know that you're pregnant. By around the 8th week, you should definitely visit your gynecologist at latest. Secondly, there will be a series of blood tests that you have to do, which are called the antenatal tests that the doctor will ask you to do. I've got a separate video on what is included in antenatal tests. I'll add a link to that in the description, but these are just tests to check you for various infections that you could transmit to your baby, as well as check your blood group and a few other general tests to make sure that you're healthy. Lastly, you should have the ultrasound scan, which is a scan which is done to check something called nuchal translucency by around week 11 to week 13. This nuchal translucency is very important because it tells us whether your baby is developing normally, your baby has any chance of having something like Down syndrome, which is a chromosomal defect, or any other chromosomal abnormality. The nuchal translucency is very important to be checked. This is done by a radiologist, and you should do it by week 11 to 13 in the first trimester. So some mothers are curious to know what happens during each week of the first trimester. So usually during the week 3 to 6, your baby starts as a tiny cluster of cells in the very beginning. The heart begins beating around week 5 to 6, and the brain and the spinal cord also start forming around this time. So what happens during week 7 to 10? Your baby develops eyes, nose, and ears at this time. Tiny fingers and toes also begin to form, and lastly arms and legs grow and the elbows can bend during this period. What happens between week 11 to 14, which is the last 3 weeks of the first trimester? So the fingernails start to grow on the baby's tiny fingers. The baby can now move and kick inside you. All major organs of the baby are formed by week 12.